I chose nursing when I was 13 years old. I had won a contest to be a nursing assistant at a local nursing home.
I feel like I've wanted to have a career in the healthcare field for a long time.
And got in there and realized that all my grandparents were there and literally adopted a ward of people over the age of 65. And at that point, I was hooked.
I was diagnosed with type 1 diabetes when I was 14, so I definitely want to be able to help people like me.
Initially, my decision to become a nurse was influenced by many of my friends who were here in the States.
I originally wanted to work in law enforcement, and I've always wanted to choose a career path that was service-oriented.
When I was a child, it was one of my goals to be a nurse. This was back in Nigeria. But there wasn't a lot of opportunities.
And was a military police officer in the Army, and wasn't necessarily what I was looking to do, and was lacking the service aspect that I thought that it would provide. So I've transitioned into a career in nursing and healthcare.
I went to University of Texas and became an art history major, kind of being a rebel. And halfway through, I think my junior year of college, I went, what is wrong with me? I feel like I need to do something to be helping people and just working with people.
I really love to help people, and both my parents are in the medical field, so they kind of got me into that.
And without even consulting my mom, I started taking pre-nursing classes. Called my mom, I think, 6 months later, and I said, Mom, I've taken my first semester of pre-nursing classes, and I'm going to be applying next year to nursing school. And she was completely floored.
And then I've always, when I was little, decided I wanted to be in the medical field because it's a great field, helping people.
Nursing and medicine are complementary but different professions. Nurses treat the human response to the disease or condition, and physicians actually treat the condition.
We believe very much in the compassion, caring aspect of nursing. We're very concerned with pain management, making sure our patients don't suffer.
Everyone's working in tandem, and the nurse is the person that usually has the complete picture of that patient.
We are the frontline people. We are the people that are there to see the beginning of a complication, something going wrong, the patient going downhill.
Today they have the fortune of having all these machines and things that help monitor the patients. In our day, we didn't have any of that. We just had antibiotics coming on the scene, so we didn't really have all the medicines.
Behind that, though, is a very scientific mind with all of the clinical knowledge that is out there and available so that our nurses can make the right decision when it's critical care time.
One thing I like about nursing is a good mix of people and science. I've been interested in medical science for a long time now.
You can learn so much about the human body, and there's so many different things that they still don't know about it. So that was one thing that kind of intrigued me.
Today, nurses also have to know all of the technology. They need to know all the physiology, pharmacology. It is a very complex field, and I can't think of one that is more rewarding.
What we used to have at the master's level, we're now promoting at the doctoral level. And so we're going to have to increase the educational level of all of our healthcare workers.
I love teaching because it's fun to stand in front of kids and teach pathophysiology and see that they're lost and they have no idea what I'm saying. And being able to, in a short period of time, get them where I want them and challenge them and stretch them. And you see them just pop and light up when they do that.
Faculty are here because they want students to learn. They want people to graduate as caring, competent nurses. That's what we're all about. That's our only goal, and we want each student to be successful.
It is now one of the leading nurses schools in the country. Certainly the leading school in Texas, but and that's a country in itself.
Partners started out with a group of some of us nurses and some of us community members as a way to really promote nursing as a profession and especially promote attendance and graduation from the University of Texas?
Partners is an organization that raises money to help people, men and women, with a calling to become excellent nurses.
The students we get at UT are top-notch students. They've been screened. We have about 10 applicants for every student that we accept. They get an outstanding education here. Where else but the Texas Medical Center could you get such wonderful clinical training?
I believe that the students are here definitely understand that nursing is a very serious career. It's a career and not just a job.
Now that I'm actually into nursing, I didn't think that I would actually love it as much as I do.
When I was thinking about going back to school, one of the things I was contemplating was how was I going to afford it.
Without the scholarship, then those kinds of opportunities would have been more difficult because, nursing school is demanding and there's not a lot of time for things besides schoolwork.
This is allowing me the opportunity to be able to go into a career that's going to help people and that's going to impact future generations.
That's where the partners really sat in, was the fact that they gave me that opportunity to be a young man, to be a young husband, a good husband, a better father, and a better student that I would have had to been if I did not have the scholarship from the partners.
And not have to leave school with $30,000 of debt, maybe $40,000 of debt, and without it, I would have just been trying to swim out of student loans.
I wouldn't have been in this program if they hadn't given me that help.
The best thing about partners would be, I believe, just the nursing school that we support.
The best thing about partners to me is their enthusiasm. They love the students, they love the school, they love what they're trying to accomplish. They set fantastic goals to achieve new levels of excellence.
When Mary started nursing school, I decided, well, of course she needs to be a life member of Partners. And so my mother got a life membership. I have a life membership, and I'd really like to encourage every single person in the audience to buy a life membership for themselves, for their family.
It's just amazing to me to watch their enthusiasm, their commitment, and to see the results.
Consider giving a gift of a life membership to anyone you know who is graduating or has graduated from the University of Texas School of Nursing at Houston.